anterior cruciate ligament injuries are common among athletes. But do all injuries require surgery? The answer is no. Treatment for ACL injuries may vary depending on the severity and activity level of the patient. While some athletes choose surgery to restore function, others may opt for non-surgical treatments such as physical therapy and rehabilitation. First, let's look at which ACL injuries do require surgery. First, the ligament is completely torn. A completely torn ligament cannot heal itself and must be surgically repaired to restore stability. Second, the ligament is partially torn but still affects life and work. Partial tears may heal on their own, but surgery may be required if they interfere with daily activities. Third, ligament injuries often recur. If the ACL is frequently injured, it will increase the risk of further damage to other ligaments without surgical repair for a long time. So why do some athletes continue to compete even after injuries without surgery? It's all about risk versus reward. Some athletes do not have surgery mainly because of the degree of ligament injury is mild and the recovery ability of the ligament itself is strong. Through physical therapy and training, it can reach the level of being able to continue sports. Surgical risks and recurrence rates are high, requiring a long period of rehabilitation. For professional athletes, the time cost is high. Some sports do not require high joint stability and can make up for the deficiency caused by ligament damage in other ways. Compared with other players, physical conditions and skills have advantages which can avoid aggravation of injuries. In some cases, athletes may feel able to continue playing despite an injury, while others may not want to risk further injury. I would like to conclude by saying that the decision of whether to undergo surgery, while a personal one, should be made in consultation with a medical professional.